Hi everybody, my name is Richard McMunn from the interview training company passmyinterview.com, and in this video tutorial I will teach you how to pass a doctor interview. So if you are being interviewed to become a doctor with any medical centre, hospital or NHS Trust whatsoever, please do watch this video from beginning to end because it will make a huge difference to your preparation. Now, before I get into those doctor interview questions, the tips and the suggested answers, a very warm welcome to this interview training tutorial. My name is Richard McMunn, that's me there in the centre. I've been helping people for about 20 years now to pass interviews successfully, and I do that primarily by giving you top scoring answers to the type of interview questions that will come up. Please do make sure you subscribe to my channel by clicking the red button below the video, and that way you are not going to miss out on any of the tutorials I upload. And I would also very much appreciate your support on this channel if you give the video a like. Thank you very much. So let's get into those doctor interview questions and answers. Now, you can either take notes as I progress and write down the suggested tips and answers, or if you stick around and watch the video from beginning to end, I will tell you where you can download these and other doctor interview questions and high scoring answers. So here we go. The first question, pretty much guaranteed at your doctor interview, will be, so tell me about yourself. It's the first question that will come up. So 2 important tips when answering this successfully. Make sure you demonstrate the core qualities that a doctor requires of attention to detail, being caring and compassionate when required, obviously working with professionalism at all times, adhering to high standards, demonstrating confidentiality, and also following strict rules and procedures. The second tip is to demonstrate an awareness of how much pressure doctors are currently under and your ability to manage the workload and the stress that comes with the job of being a doctor. Now, doctors do an incredible job. They do an incredible job, but they are under pressure. Of course they are. You know, they're under pressure, and you have to be able to handle the pressure as a doctor. So we need to put that in to your answer to the interview question, tell me about yourself. So here is my suggested answer. I am a hard-working, conscientious and professional doctor who always puts the needs of my patients at the forefront of everything I do. I am a confident and decisive decision maker who also possesses exceptional interpersonal skills that allow me to demonstrate the right levels of empathy with patients when appropriate. I am also someone who can work collaboratively with other medical staff and hospital workers to continually strive to deliver the best levels of patient care at all times. I will always maintain confidentiality at all appropriate times, follow strict rules and procedures, and will continue to develop myself professionally so I stay at the forefront of the medical profession whilst performing my duties as a doctor. Finally, I am someone who can manage pressure and stress well and will always take care of my workload to ensure the required professional standards are maintained. That is a strong, intelligent answer. It's quite in depth, which I like. You're using lots of powerful, positive keywords and phrases that demonstrate that you are the right person for this particular doctor role. You will also notice that I don't mention anything about the things you do outside of work. Okay, they are not interested. They are only interested about how your key skills and qualities will be a match to the role of a doctor. So that's a really good answer. Don't forget, I'm going to tell you where you can download this and others as we progress through the tutorial. So why do you want to become a doctor? The next interview question I want you to prepare for. 2 important tips. Think of 4 to 5 reasons why you want to become a doctor. Take a piece of paper and write down 4 to 5 reasons. Now, by listing a set number of reasons, it shows you have thought carefully about the reasons why you want to become a doctor, and you are not just thinking on the spot when they ask this question. You've already thought carefully, and that's important. Now, positive reasons to become a doctor include obviously caring for others, influencing others through help and advice, being in a highly responsible and rewarding position. Job security is a good one, and working with others to improve the health and well-being of the patients you are looking after. So here's my suggested answer to the interview question, why do you want to become a doctor? I want to become a doctor for 5 main reasons. The first reason is I genuinely care about people and I want to be part of a medical team that provides the highest levels of care achievable. Secondly, I enjoy working under pressure, and I will feel a great level of professional achievement when I am working under strict time constraints. The third reason is I want to be in a position where I can influence people to make better and more informed decisions about their health and well-being. Being a doctor is a highly responsible position where I will be able to help people live longer and more healthier lives through the better choices they make. The fourth reason is I want to work as part of a wider team who are all working towards continually improving and developing the care we are all providing. And finally, from a personal perspective, the position of a doctor is a secure one. And providing I perform my duties to the highest standards possible, I will always have employment within a highly satisfying and rewarding role. So 4 of the reasons are based on the needs of patients and helping them. And then one of them, which is fine, is from a personal perspective, the job satisfaction and the job security aspect of being a doctor. So you are heavily weighting the reasons why you want to become a doctor on the patient and helping them, which is the important part. Next question, how do you react to highly stressful situations? Now, I can pretty much guarantee a question based around your ability to handle stress and deal with it will come up during your doctor interview. So a couple of tips for getting the question correct during your answer. Have a plan in place already for dealing with stress. And especially my advice is to do it through mindfulness, being mindful that you're going to be in stressful situations and have a plan that you follow. Now, you might decide to follow a set procedure when dealing with stress that you can utilize during your answer to this interview question. First and foremost, remaining calm, thinking of your objectives, what do you want to get from this situation, managing your emotions, taking the lead in situations, and also using the resources and the people available to you to deal with the stressful situation. So here is my suggested answer. How do you react to highly stressful situations? First and foremost, it's important to be aware that with the position of a doctor, you are going to encounter stressful situations on a periodic basis. The way I personally manage stressful situations is first and foremost through mindfulness. I understand there will be stress within my job, and therefore I am prepared fully for it in the way I react to it. I always deal with stress by remaining calm, considering carefully what my objectives are when in any stressful situation, and also what I want to achieve. I never get angry, frustrated, or short-tempered, as these reactions will not allow me to deal with a stressful situation effectively. I also deal with stress by making sure I am professional in all of my actions, whilst following my training and the strict rules and procedures required by the trust or medical profession I am working for. That's a great answer and shows that you already have a thought process at the very least in place, or a plan for dealing with stress. Next question. How would you deal with conflict between yourself and another member of the medical team? This kind of situation happens all of the time. You might have a disagreement or there could be conflict. Now, this question could be posed by them saying, how would you deal with conflict between 2 other members? But this answer is great for both of them. Here we go. So, first 2 tips for answering this question. Put the needs of the medical profession or the patient first, always. That's very important. Remember, there are 2 sides to every conflict. You should be professional, seek to resolve the conflict by achieving a mutually beneficial outcome, and be prepared to be flexible when dealing with a conflict. Also, set realistic goals for any discussions that take place between you and the other person. Consider the reasons why there's conflict. So sit down and say to yourself, why is there conflict here? Rehearse what you want to say and what you want to do. That's important. Before you meet with a person, think carefully about what you're going to say and practice it. Hold any interactions or meetings in private, of course, and then agree and confirm any resolution between yourself and the other person. So here's my suggested answer. How would you deal with conflict between yourself and another member of the medical team? Conflict does occur on occasions within stressful work situations, but how you deal with it is an absolute priority. I would first of all ascertain what was causing the conflict and determine what it was both parties wanted to achieve from any resolution. Above all, I would put the needs of the medical profession I was a part of first. Conflict is counterproductive, so I would work hard to resolve it. I would consider carefully the interactions between both parties, discuss openly the reasons for the conflict in private, prepare to be flexible during any conflict negotiations, and also take into consideration the other person's needs. Above all, I would look to resolve the conflict quickly, amicably, and in a manner that allowed both parties to move forward positively. The most important thing when dealing with conflict is that you are not putting your needs first, you are putting the organisation or the patient's needs first. That's very, very important. Next question of your doctor interview. What skills and qualities can you bring to the role of a doctor? So, a couple of tips. Read the job description for the position you're being interviewed for and the person's specification for the doctor's position, because although you probably already know what the role of a doctor is, there may be additional duties required for the particular post that you're being interviewed for, so make sure you read it. And then where possible, give examples of where you've already demonstrated some of the skills required to be a competent doctor. So you could say, one of the qualities and the skills required is to make sure I keep up to speed with continuous professional development as a doctor. For example, I have been doing this by XYZ, and then you would explain what you have been doing. Here is my suggested answer to what skills and qualities can you bring to the role of a doctor. The skills and qualities I have are many and varied, including ensuring I put the care of my patient above everything else, providing exceptional levels of care, keeping myself up to date with developments from within the medical profession, and also recognising the limitations of my competence. I am also able to recognise when a patient's safety is put at jeopardy or if they are being compromised. Being able to utilise outstanding communication and interpersonal techniques, and also treating all patients as individuals whilst respecting their dignity. Finally, other skills and qualities I possess include treating all patients carefully, politely, professionally and considerately whilst listening to their needs, and also respecting a patient's rights to confidentiality. So there are other skills and qualities that you might want to throw in there, but that, in my opinion, is a really strong answer to the question, what skills and qualities can you bring to the role of a doctor? It's a professional answer, which is great. So if you would like my full set of 22 doctor interview questions and answers, either click the link in the top right hand corner of the screen or the one directly below the video in the description, or you can go to my website passmyinterview.com and you can download the full set of 22 interview questions and high scoring answers for becoming a doctor. I hope you've enjoyed that. Please don't forget to subscribe. I don't want you to miss out. I'd also appreciate it if you share the video and give it a like. Thank you very much. Thank you for watching, and I wish you all the best in your pursuit to passing your doctor interview. Have a brilliant day.